HealthBreak is sponsored by
Providence Health and Services, serving Montana.
Around 30 million Americans have reflux disease, a recurrent heartburn caused by stomach acid splashing back into the esophagus. Dr. Robin Hape from Providence St. Joseph Medical Center in Polson describes the symptoms.
GERD can be a very uncomfortable situation. It can cause a lot of problems sleeping. It can cause irritation of the vocal cords and cause a hoarse voice or chronic cough. But long-term GERD can cause erosions in the esophagus, which can also lead to esophageal cancer if not treated.
Fortunately, Providence, Montana offers the TIF procedure to treat reflux disease, and this surgery does not require an incision.
It's a wrap that's formed around the esophagus to prevent acid from washing into the esophagus. The TIF procedure is performed transorally. It's all done through the mouth with a camera, so there are no incisions on the abdomen. It takes about 45 minutes to perform. It's a same-day surgery procedure. Patients can go home the same day.
And the results can be life-changing.
The studies have shown that about 75% of patients get completely off of their medications and are symptom-free, are sleeping better, are reporting less coughs, less hoarse voice, things like that.
To find out more, visit montana.providence.org.
HealthBreak was sponsored by
Providence Health and Services, serving Montana.